Australian Health Journal. My name is Dr. Anne-Marie Casidlo. Since our last broadcast, there have been a number of high-profile individuals who have spoken out about their own mental health issues. The positives that come out of this is more open discussion and awareness in the wider community, and hopefully this will in turn reduce the stigma associated with mental illness. Unfortunately, there isn't a simple blood test or scan that can make this diagnosis, so it's important that healthcare providers speak to their patients and try to find out if there's anything concerning them. It can be as simple as how you're feeling otherwise, or what else is happening in your life. And this can often open the floodgates and uncover symptoms of depression, anxiety, and other mental health concerns. In our special report, we'll be speaking to a number of mental health care providers to find out more about mental illness. But before we start, let's check in with Helen to see if there are any updates in relation to any news in recent healthcare.
Australia is set to practically eradicate cervical cancer following the completion of a 10-year review of giving schoolgirls aged 12 or 13 a free HPV vaccine. Since 2007, the level of 18 to 24-year-old women with HPV has sharply fallen from 22.7 to 1.5%. The International Papillomavirus Society announced in March that Australia could become the first country to completely eliminate cases of cervical cancer. Susan Garland from the Royal Women's Hospital and the University of Melbourne advises on World Health Organization and global policymakers on cervical cancer prevention and screening. Professor Garland has stated over the next 30 to 40 years, rates of cervical cancer will drop from around the current 1,000 cases a year in Australia to just a handful. Across in the Medtech industry, the Medical Technology Association of Australia, also known as the MTAA, is preparing to host a summit on value-based healthcare on the 24th of April at the Medtronic Australian headquarters in Macquarie Park. MTAA CEO Ian Burgess spoke to the Australian Health Journal about the association and the upcoming event.
Hello, my name is Ian Burgess. I'm CEO of the Medical Technology Association of Australia. Our members are manufacturers and suppliers of medical technology that's used in the treatment, diagnosis and management of disease and disability. They range from small Australian companies that may have turnover of less than $1 million through to large multinational companies. And around 80% of our members are SMEs. The technology can include wound treatments, syringes, hospital consumables, through to high-tech hospital equipment, and the high-tech implantable devices such as pacemakers, defibrillators, neuromodulators, hip replacements, knee replacements, and other orthopaedic implants. Representing the medtech industry in Australia, MTAA is the voice of industry, and advocacy on behalf of our members is one of our key purposes. And our fundamental purpose as an industry is to save patient lives and improve patients' lives. And as MTAA, our fundamental purpose is to ensure that medical technology is valued as a key driver of a healthier technology. So in that role and representing the industry, government clearly wants to deal with MTAA, and that was apparent during the reform processes of the federal government last year to reform our private health system, and in particular private health insurance. We're actively involved with government in that process as it continues, and government is always seeking our input on broader health policy issues. In terms of education of the industry, we play a key role of developing policy changes and formulating those and communicating those. Value-based healthcare is a current example which has the potential to address a number of challenges that the medtech industry and the health sector more broadly currently faces. And that's within the context of a constrained health dollar, an ageing population, chronic disease, all of which is driving up our health expenditure as a proportion of GDP. So value-based healthcare, where we are conducting a summit on April the 24th, a one-day conference that is addressing value-based healthcare, its benefits, practical issues around implementation, and how we can progress the discussion in Australia around the benefits of value-based healthcare for Medtech and how we operationalise that both within individual companies and within our regulatory and reimbursement systems.
New medicines added to the Pharmaceutical Benefits Scheme from April 1 are set to benefit tens of thousands of Australians with diabetes. Increased strength insulin drug Toujeo treats both type 1 and type 2 diabetes. The current cost of a private script drops from $700 to $39.50 or less. Adding two other listings, Glixambi and Qtern, to control type 2 diabetes has given Federal Government Health Minister Greg Hunt claim to Australia being world leaders in diabetes treatment. Lastly, and in a loss to Australia, Professor John Maddock, Executive Director of the Garvan Institute of Medical Research and Genome One, will soon be leaving to head up Genomics England, the world's largest clinical genomics initiative. Professor Maddock is noted for his scientific contributions to the understanding of the human genome and has over the past 6 years at Garvan recruited some of Australia's most experienced researchers in cancer, immunology, bone biology, diabetes, neuroscience and genomics. We wish him well in his new role. Now let's hear from Dr. Anne-Marie Kazidlo on our feature story on mental health.
Last month on the 30th of March, Australia, with the rest of the world, celebrated World Bipolar Day. Bipolar Australia founder and Executive Director Susanna Bluewell joined Prime Minister Malcolm Turnbull, Federal Minister for Health Greg Hunt, and other parliamentarians in creating awareness for bipolar by the symbolic blowing of bubbles to represent the depressive phase of the condition.
My name is Susanna Bluewell. I am the founder and the Executive Director of Bipolar Australia. Bipolar Australia was created 4 years ago in 2014 to answer a few needs for people with bipolar. We did not have, for instance, anywhere to celebrate World Bipolar Day. And as it was set exactly in 2014 for the very first time by the World Bipolar Foundation and the Australasian Association, I personally wanted to bring that to Australia. And we started by a very small celebration with a bipolar support group that I've been facilitating, and that was a stall in a shopping centre. And then we had organised for the following year, we organised a conference, Living with Bipolar, for the whole day. And the following years, like having a stall in Martin Place. In 2018, we celebrated World Bipolar Australia with two major events. One, the launch of a booklet, Coming Home with Bipolar, information for carers and families. When we put together this booklet, we had in mind that the main audience we want to reach are the people that are going to give this booklet to the family and the carers, because without that help, the full project is not complete. So the GP, when sits with the family and it comes the time to confirm a diagnosis that maybe the psychiatrist has given, or maybe the same GP would send the person to a validating clinic, like for instance the Black Dog Institute, to confirm the condition. So the second event I mentioned was Bipolar Australia was invited to go to the Parliament House in Canberra to blow bubbles for bipolar with some ministers, mainly Minister for Health, Greg Hunt, he invited us to participate, but mainly also Ken Wyatt spent some time finding out what are we doing, why we're blowing bubbles, and they took copies of this booklet, and we felt that for them to have some idea of the needs of consumers is important, because after all are them the ones that are going to make some decisions about our new budget. The booklet was launched on the 26th of March, within the week of World Bipolar Day, and it was at the New South Wales Parliament House by the New South Wales Mental Health Commissioner, Ms. Catherine Lourey. She's spoken of the booklet as a very good resource that families now can access to help their loved ones. This booklet was thought in a format, apart from the written information, it gives the stories of three families, quite different, and their journey is also quite different. So as you go through the story, they will introduce themselves, but then you will see how the carer and the person with bipolar, they were relating to each other. So it's an easy reading, but full of information.
Bipolar disorder has historically been treated using lithium, discovered by the Australian John Cade in 1949. Psychiatrist Greg Damore has written the book Finding Sanity on John Cade and his work.
My name's Greg Damore. I'm an Associate Professor of Psychiatry based at Westmead Hospital. I'm interested in a whole range of things. I'm a clinical psychiatrist, but I'm interested in the history of psychiatry, and in particular I've been fascinated by Australia's greatest contribution to the history of mental health, and that is the discovery of lithium by John Cade to treat bipolar disorder. This was in many ways the penicillin story of mental health, and is one of Australia's great unsung stories. This is the book I wrote called Finding Sanity, and it's the story of Australia's greatest mental health accomplishment. It's really a remarkable story that took me about 10 years of research to unravel. It's the story of John Cade, who was a young doctor, went to war during the Second World War, was captured by the Japanese, was incarcerated in Changi as a prisoner of war for 3.5 years. He survived that terrible ordeal, returned to Melbourne, and in the first years after the Second World War, discovered that lithium could be used as a treatment for bipolar disorder. What's truly remarkable about this discovery is that, firstly, it was an Australian discovery, and secondly, it was the first effective medication ever discovered for any mental illness. It's really a story that all Australians should know. Sadly, they don't. And part of the motivation for writing this book was to try and spread his story throughout not just the medical community, but through the Australian community at large.
Diagnosis of bipolar remains difficult, and opinions vary due to the symptoms common to depression. In research underway at the Westmead Institute for Medical Research, Dr. Mayesh Korgokar talks about the importance of finding biological markers in diagnosing bipolar disorder.
My name is Mayesh Korgokar, and I'm the Research Director at the Brain Dynamics Centre here at the Westmead Institute for Medical Research and University of Sydney. My research centre works towards understanding the brain, in understanding the brain underlying mental disorders. So our research is specifically targeted towards how we can use this understanding to help people with mental disorders. Today is World Bipolar Day, and we are here to do a community event where the goal was to spread awareness of this disorder, to basically understand the stigma, to help people understand that this is an important disorder, and but there are resources. There's a lot of research and clinical activity which is going on to to help this disorder. So today we had a community event here at the Westmead Institute for Medical Research around World Bipolar Disorder Day. We invited people from the Western Sydney, typically the entire Sydney community, and we had a first event where we blew bubbles. Bubbles symbolizes the mood of bipolar disorders. Bubbles meaning when people with bipolar disorders are manic or happy, and when bubbles burst, they feel depressed. So patients with bipolar disorder can go between the manic and happy states and the depressed states. After that, we had a panel, exciting panel discussion with experts, clinicians and researchers, where we talked about how the community can, for the community to understand how bipolar disorders is diagnosed, how the disorder can be detected by family members, what sort of help is available for these people, how do clinicians typically treat people with bipolar disorders, what's the impact bipolar disorders has on people's life and their families. And we also discuss about the type of research which is happening in this disorder and how this research is geared towards in helping people with bipolar disorders. So our research study is funded by the National Health and Medical Research Council of Australia, and our research is geared towards identifying biomarkers of bipolar disorders. One of the problems with bipolar disorders is that there's a significant delay in diagnosis of bipolar disorders. Often people with bipolar disorders get misdiagnosed as depressed, and that's because clinically there's a huge overlap in symptoms in both these disorders. So the main problem with this is people with bipolar disorders don't necessarily get the right treatment earlier on. And there's often a significant delay from the onset of the disorder to actual diagnosis, and which means it has a significant impact on someone who's suffering with bipolar disorder. So our research is mainly targeted towards that question, where we want to compare people with depression and with bipolar disorders. We are using cutting-edge tools to understand the functional and structural architecture of the brain and see if we can identify biomarkers which can tease apart these disorders. So eventually these markers could help clinicians in their clinics to, for an early diagnosis, to get an appropriate diagnosis, and for someone with bipolar disorder to get the right kind of treatment earlier on.
This is the end of our first segment on mental health. We'll be back with part 2 later in the program.
In this month's professional profile, Newton Srivastava runs Tread Consulting and is solving the skills gap in nursing, pathology, dental assistance, aged and childcare. Listen and be inspired with her and her growing enterprise.
I'm Newton Srivastava and I'm the director of Tread College. We specialize in healthcare, so it's a healthcare college, and we have been operating since 2009, and I have been in the training industry for 18 years now. We are based in Macquarie Park in Sydney, and Macquarie Park is actually a kind of health precinct because we are very close to Macquarie Hospital and a lot of pharmaceutical companies and pathology companies like Lavity in the area. And we do specialize in healthcare, as I mentioned, but what it means is we provide accredited and nationally recognized qualification for students here who want to build a career in healthcare, like pathology collection, dental assisting, aged care, childcare, and nursing now. And basically what we're trying to do is we're trying to bridge that skill gap here, because there is a massive shortage in healthcare, as we know. So we are trying to bridge that gap and train as many students as possible here to be able to build a career in healthcare. Currently, we are training some of the students here in Sydney, and they contact us directly and of course enroll in the course. But we also network and work with a lot of organizations in the healthcare industry, like hospitals and nursing agencies and dental surgeries and even medical centers. So they have a lot of staff there that needs training and bridging that skill gap. So they contact us directly and we are training the students there. So currently we actually have the capacity of 600 to 700 students here at the Macquarie Park campus. And this is a fairly new campus. We only recently opened a few months ago, in fact, mid last year. So we are still currently expanding here, and this center was predominantly opened for nursing, because we have recently added nursing on our scope, and for nursing we need to set up hospital labs and some of the simulation things, and so this center is perfect for that, and our vision is like not just being in Macquarie Park, we are actually expanding overseas as well. So we are recently opened a campus in Sri Lanka, and in India, and in Philippines actually. Philippines is just being set up at the moment. So our whole vision is basically we are trying to improve our international engagement and not just train students here in Australia and bridge that skill gap, but also take the Australian standards of training all over the world where it is required. Like for example, in Sri Lanka, I actually recently came back from there, and I was engaging with some of the organizations like hospitals and some of the community organizations like Save the Children Foundation and funds. The need for training and the need for skills there is pretty huge, because there is no structured training there, especially in countries like Sri Lanka and India. So what I'm trying to do is take the Australian standards from Australia, take it to the countries where it's needed, and help the students improve it where they are. And in the process, there might be some of the students who might want to come to Australia and complete their qualification here and do some work placement here in Australia and go back to their country and help improve the standards there. So there is a bigger vision than just training students and issuing them the certificate. So that is just the beginning of what we are trying to do. I'm also looking at improving our presence not only in Asia but also in European countries. Like I'm looking at offering our courses in the eastern part of Europe, especially Czech Republic and Slovakia, and we're in the process of achieving that. And in the next couple of months, we are also looking at opening a campus in Canada. Basically, the whole idea is to take Australian standards all over the world where it is required and help them improve the standards there. I have been in training industry for last 18 years or more. I think it's more than 18 years now. And through the journey, I actually realized that there was a massive need to improve the engagement in the training industry, especially in the healthcare sector. So it's in 2009, I decided to actually start my own training organization. So when I started, I only started with aged care, and then slowly, started adding qualifications on our scope. And since 2009, January, actually, it's been an incredible journey. And now we are looking at specializing in healthcare, especially nursing and pathology, and making it our flagship program. Now, the journey for TRED actually started a few years ago, and now where I am, it's of course we are growing from here, but it has not been that simple, obviously. And some of the challenges that I faced in the very beginning was just making the right contacts in the industry, because running a training college is one thing, but just complying with all the requirements and the guidelines. Yes, I mean, I had to actually figure it out all by myself, and which I did, and I'm still doing that. But one of the things that I would see that as running a training college by myself is improving the engagement with the organizations such as the Department of Education, ASQA, that is the regulatory body, and also the industry engagement. Now I'm currently working very hard to improve that industry engagement. Now what do I mean by industry engagement is the hospitals and where the healthcare is required. So the engagement from the industry is very, very important, and from the very beginning, that's one of the challenges I have faced, and I'm still working on it. It's a work in progress, but at the same time, like as we know that healthcare is a national shortage, it's just not in Sydney. I would like to move that into some of the regional areas as well, not just in New South Wales, but all across Australia. Like next year, we are looking at moving into some of the regions of Victoria and Queensland, and also South Australia. But to move there, of course, we need a little bit more of industry to come forward and engage with us and maybe give their input on what are the requirements. Like in Sydney, being in Macquarie Park, sometimes it's easy for me to go and meet the industry representatives here, but it is not always very simple to reach out in the regional areas and improve those engagements. So this is what I would like to be working in the future and try to overcome some of the challenges, and also the training industry to be cooperating with each other. I know the vocational training industry has been in the news since for the last couple of years for all the wrong reasons, but there are a lot of players who are actually trying to do the right thing and work hard and provide quality training. So all those training providers, in my opinion, we need to kind of improve our engagement a little bit more, and that's one of the biggest struggle of this industry, that the engagement is not there, and this is what I would like to see changes in the future. But because the opportunities are huge in this industry, I'm sure if you speak to anybody in the healthcare industry, whether it is hospital or whether it is nursing agencies or even pathology or anywhere in the medical industry, everybody would say the same thing, that there is a skill shortage. It's hard to find employees with proper skills and properly trained. So definitely the demand is there, the shortage is there. So we just need to streamline the whole process of the people who want to build a career in healthcare and the employers and the training providers. So there has to be a bridge that should kind of bridge the gap pretty much and improve the engagement. And I think that is where a lot of organizations such as Austrade, who can improve our international presence because we are looking at improving our international presence. So Austrade and organizations like ASQA, who regulates those courses for the training provider, and some of the the industry, the big industry players can actually come forward and improve that engagement.
The Australian Doctors Orchestra has been playing music for 25 years and recently raised $60,000 for Huntington, New South Wales. Let's hear more from this wonderful group.
I'm a plastic and reconstructive surgeon now practicing in Melbourne, mainly now in the field of skin cancer oncology and especially melanoma. Do a lot of melanoma. I was aware of Doctors Orchestra all over the world, especially in Europe and Germany. And there was a chamber music summer school in Mount Buller, which was held in January, and after the first one of those in '92, there were a disproportionate number of doctors playing string quartets and chamber music. And I thought this would be a very good way to start an Australian Doctors Orchestra, because we didn't have one. And everybody I asked was very enthusiastic to do it. And then it just sort of grew. And everybody knew someone else who could play and so on. There's also nurses and physios and dentists who play with us, and it just grew from that. The very first one, which of course is very sweet in my memory, was at the Melba Hall in Melbourne. There were 76 in the orchestra, and it was a small stage that was just as well, because Melba Hall is the University of Melbourne Conservatorium, and it was the lovely Chris Martin who worked there as a lecturer in viola and conducting, and he really was hugely instrumental in setting it all up with me. And he was our conductor for 12 years. Sadly, he passed away a few years ago, and we've had lots of other conductors since then. The idea was to play for a medically related charity, so the proceeds from the concert could be passed on to the charity. And the very first one was Multiple Sclerosis Society. We've played for the Sydney Melanoma Unit, then called Sydney Melanoma Unit, now called the Melanoma Foundation Australia. We've played for the Malcolm Sargent Cancer Fund for Children. We've played for the Glaucoma Foundation. Recently, Mental Health and Huntington's Research in Sydney.
I'm Robin Capp, and I'm the Executive Officer of Huntington's New South Wales and ACT. The ADO got involved with us just over 12 months ago. They were keen to make us the beneficiary of their wonderful concert that was held in November last year. We were able to raise much needed funds for our youth program. This program only started last year, and we employ a youth worker to work with young people from Huntington's families, as these young ones have special needs regarding living with a mother or father with Huntington's disease. Therefore, the proceeds from this concert will ensure that our youth program continues in the foreseeable future to help children and young people to understand Huntington's better, to help them to learn new ways to cope, and to help parents to talk to their children about the disease. On behalf of the board and members of Huntington's New South Wales, I would like to thank ADO for choosing our organisation as its charity for their 25th anniversary concert. It's been a privilege and a pleasure to be with you over these past 3 days, and congratulations on your silver anniversary. At last but not least, thank you to you, our audience, for your attendance today. Please be assured that you are not only enjoying a magnificent concert, but you have contributed to improving the lives of children and young people impacted by Huntington's disease. Thank you.
But always a medically related cause, and the charities have been a real pleasure to work with, because we like small charities because they usually have very motivated individuals who really... Oh, there was a wonderful neuroscience one for research in brain tumours in children. That was Brainwave in Melbourne. People who have been... I mean, we have criteria for joining. One is to have at least 6th grade AMEB as a minimum level of technical ability. Most people are higher than that, which is great, and actively playing. But if I know that someone wants to restart playing, and this gives them the opportunity to get back into playing, that's one of the nicest things we can do for colleagues. Because I just remember parts of my life when I wasn't playing, and when I was training and working too hard, they were very tough years of my life. And whenever I have time to play and be engaged in music making, my life's always more balanced and happy. So to bring people back into the fold to play, and it's done that for a lot of people, which is a really nice thing. I mean, to give you a quote from the European Doctors Orchestra, which was set up in '94, there's a lovely man, 2004, sorry, lovely man called Michael Lasserson, who was a GP, and when I went to London, I had this idea of setting up a European one, and they said, I said, who should I see? I said, go and talk to Michael Lasserson. So he's this lovely man, and I went out and I met him, and then he really ran it with me, but he did the lion's share of the work for 8 years. And when he died, I got a lovely letter. I'd already moved back to Australia. I got a lovely letter from his son, who was a professional violist, and his other son's professional cellist. He said, we want to thank you from the bottom of our hearts for giving Dad the golden years of his retirement, because his whole time was spent on running and doing the orchestra. So it gives people a lot of pleasure to be involved. We love music. We love being inside a huge body of sound. You asked me previously about how big the Hobart concert was in 2000, only because we're going there again next year in 2019. And we had 104 in the orchestra and a 25-piece brass band from the Anglesey Barracks, and we did Tchaikovsky's 1812 Overture. I mean, to be inside that sound, not mentioning the cannons, is fantastic, you know, to be inside a big body of sound. And that Shostakovich we did in Sydney last year for the 25th anniversary, that would not have been possible to play that piece back then. The standard has gone up and up and up as more younger people join the orchestra, and we're just more comfortable with it as well. So it's a real pleasure for a lot of people.
I've been involved in the ADO for the last 10 years, play every year, and it's always a great highlight of the year to be able to involve with one's colleagues playing great music. It's been fairly stressful because it's a fairly stressful weekend, but we always have a fun concert, and it's wonderful to have colleagues from all over Australia coming together to play their passion, to enjoy their passion of making music. I always enjoy playing the trombone, I always enjoy being involved with any musical event, and so it's something, it gets you out of your routine work, and it's something to look forward to. but it's also sort of innate in many doctors to make music. Music and medicine go together pretty closely, and I suppose it's something as an interest outside one's normal work, and it's so important to have those.
I've been part of ADO, Australian Doctors Orchestra, since it started in 1993 in Melbourne, and have played every year bar one of those 25 years. So this concert's particularly special because it's celebrating our 25th anniversary. So for a quarter of a century, at least 100 doctors are getting together each year, and now twice a year, to play music together. It's a last minute rehearsal over a couple of days before the concert, after rehearsing on our own at home and raising money for charity. So it's a great atmosphere. We work hard, but we have so much fun, and it's really satisfying to know that we're raising money for good medical charities.
My name is Louis Sharp, and I'm the assistant conductor of the ADO for 2017. Having the program of what we have, Shostakovich's 10th Symphony, which was premiered in 1953, as a kind of talk back to the Stalin years. Having the Australian Doctors Orchestra prepare such a difficult and passionate and fire and enthusiastic work, not showing that they always bring their passion and their fire from their day jobs into music, which they also have a real strong passion about. And that's something that makes an event like this extremely unique. Having the chance to come together with doctors from all over Australia in a single room for a very short amount of time to be able to prepare real serious symphonic repertoire is a celebration of their passion and their fire and drive towards excellence, whether it's in their day job or the artistic dream that they have possibly as a musician as well.
Yeah, I first heard about ADO when I was an intern, so a very junior doctor, and it was like a saving grace for me. I found out about it through a colleague, and so what it is, it's a large group of doctors all over Australia who are part of this membership base, and each year we do 2 concerts, and in that year, or in a particular concert, there will be some sort of 60 or 100 players out of that group who often travel interstate to join the group and to play for a few days, so usually about 3 days, leading up to a concert, culminating in a concert on day 3. It's a great group of people. I've made a lot of friends through the group, and certainly we always play for a very good cause. So this weekend we're playing for Huntington's New South Wales, which is a fantastic charity that does a lot of work for patients and families suffering from Huntington's disease. And so it's just to be honest, it's just a lot of fun for us as doctors, because we get to bring out our instruments and play together, which is very social, and work really, really hard towards a common goal. It's good fun.
I'd arrived in England in 2002, and it wasn't a difficult thing to set up because I had the model of how to do the Australian one, because there's all sorts of legal and ABN numbers and legal requirements to set up something like that. And so I used the Australian model to set the European one up. The only thing with the European one, if you use European in your name, it has to go through European Parliament. You can't just use European as a name. And I mean, it's only just paperwork, but it still has to be approved. And I'm told that someone else, I think the Germans wanted to set up a similar thing, and we'd beat them by 3 months. Well, of course, that gave my English colleagues particular pleasure. But that's a lot of fun because we play one in the UK, and then the other concert is on the continent. So the first one we played in London at Blackheath Halls near the Docklands, and the next one was in Romania, in Bucharest. And since then we've been to Hungary twice, to Budapest. We've been to Berlin several times. We've been to Italy, in Verona, which was absolutely stunning. Holland, Rotterdam last year, middle of the year, and Belfast. We'd played Mahler 2 in Belfast with a medical choir, which was amazing. That actually formed the choir specially for that concert. And I don't know if you know it, but it's the most amazing. Mahler 2, The Resurrection, it's called, is the most amazing piece of music. It goes for 85 minutes, and there's nothing else on the program. Of course, it's one piece concert, and it worked beautifully. And they got all these singing doctors from all over Ireland. In fact, the choral master said that this weekend there'll be no proper choirs in any of the parishes in the whole of Ireland, because they're all here in Belfast singing this concert. And the really nice thing is they've stayed together as a group, and they've stayed the Irish Medical Choir, I think they're called. And that's nice. It's nice for them, and it's just a nice activity for everyone. Age 6, my mother thought it'd be a good idea for me to learn the violin, which I learned from a member of the Budapest Opera, violinist. And then I continued that, and I played the violin all through the years, but I've always had a wonderful love of the viola sound, which is deeper, of course. But the difficulty is it's a different clef, so you have to learn the clef. And I put it off, and about 10 years ago I bit the bullet, and I said, I've just got to commit myself, I'm going to play viola. And so I play both still, but I do love the viola, so I'm really more a violist. The interesting thing is, if I pick the violin up, it's so automatic, there is no cerebral anything, it's just there. With viola I still have to think sometimes if it's sharper and flat and what the note, it's not as automatic. Still, I'm only 70, so I've got plenty of years to go.
Let's now continue our segment on mental health. Mental health has gained particular attention with medical professionals such as psychiatrists and psychologists treating particular demographics. In a recent Young Men's Health Forum run by the Conviction Group, Dr. Jason Pace and clinical psychologist Lyn Worsely talked to us about some of the considerations with this cross-section of the population.
I'm Dr. Jason Pace, I'm a psychiatrist in Sydney, and I'm the chairperson for the Conviction Group board. And here we are today, it's Monday the 26th of March, we're at the Youth Forum, one of many forums that we run across Sydney. This happens to be in Parramatta in Western Sydney, and it's attended by roughly 20 schools. We have about 300 or just under 300 children here today, all boys in year 10, and talking about very important mental health issues for the young men. The work the Conviction Group does is important because it approaches mental health issues in a different way. So mental health programs really work on a community-based program and a preventative program rather than looking at the aftermath of what happens. So we're really trying to get through the stigma associated with mental health issues by making this a community problem rather than an individual problem. The second thing we do, I think is very different, is that we use young people to talk to other young people. Again, this helps us get through to kids a lot better. Young people respond a lot better to another young person who's maybe a few years older than them rather than a professional or a teacher or a parent. We know one of the big problems with addressing young men is getting them to talk and getting them to feel a confidence in the person they're talking to. And what we do at Conviction Group is we get volunteers who are in their early 20s usually to do a lot of the work with the young boys, and it makes a big difference to what the results are going to be. The new approaches to mental health treatment in this demographic and in young people boys and girls really. It comes down to more about how we approach the treatments. The treatments themselves haven't changed a great deal. We still use a combination of mostly counselling types of therapies and medication types of therapies. But where it really, I think that a lot of the advances has been made is in how we deliver these treatments. So we know that young people respond differently to adults. We have a lot of research now looking at what young people want from their treatment, and so things like using more online therapies, more social media, even things like even messaging, SMS messaging rather than a face-to-face interview can be more acceptable to a young person. They really like the types of therapies they can seek anonymously and secretly, I guess, and privately, where maybe even their parents don't even know that they're getting help. So a lot of the focus has been both in private and in government sort of services to try and move modalities a bit more accessible to young people. We know the biggest problem in getting people help is access to help and trying to remove as many boundaries as possible to a young person seeking help. That's where really I think a lot of the treatment advances have been made. A lot of work's been done recently in the medical profession to recognise the importance of mental health and how it impacts not only just on the individual and a mental health issue, but also on overall outcomes of people's health. We know that people with suffering mental illness tend to seek help a lot less and to have poorer compliance with treatment and as a result have poorer outcomes. So I think medical professionals in all sorts of fields, whether it be a medical or a surgical or a psychiatrist, are recognising now more how to identify someone that might be suffering a mental illness and how to actually get them for help, because overall, if you address these issues and you get those things addressed, then I think your overall outcome for the patient is going to be a lot better. So I think a more holistic approach to the patient, not just from what they might present with, but what also might be contributing to how you're going to treat that patient has been increasing awareness of that. And I think most medical professionals now can recognise that as being a very significant part of what they do.
Some of the programs we have at the Resilience Centre for young people are ones that build on their relationships. So we particularly focus on looking at their moral development, particularly focus on helping them to be socially savvy, and also particularly focus on helping them to navigate and negotiate with the people around them. All of the programs we've got are based on the Resilience Doughnut, and also particularly helping young people to connect who may be struggling with their social anxiety or perhaps social skills. So one of the programs is called Linked Up, and Linked Up is really about helping the young people to work out whether the relationships they've got going well for them and linking them together so that they do some sort of a kindness project. And the success we've had has been incredible. We've also got other programs such as helping young people to manage through separation and divorce in their family. We've also got relationship programs which help the young people to manage when they're coming out of a broken relationship. One of the other skills that we've got is a dialectical behaviour therapy program, which is for those young people a little bit older who might be struggling with how to manage their emotions, helping them to keep their emotions intact and giving them better life skills. The Resilience Doughnut is a model, a psychological model that's based on research, and the model looks at how we build our resilience skills, and it enables us to see where we're actually getting our resilience skills from. So resiliency is really about social navigation and negotiation. So navigating and negotiating with the world around you so you can cope with tough stuff. And that's a lot about social skills, psychological skills and ways of managing people and managing their surroundings. So with the Resilience Doughnut, it's just a model that enables us to see where our strengths are, where are the relationships that are best serving us, and it tells us that ways that we can link those strengths to build on our own internal characteristics and our own strengths that we can cope with in the future. So it's both a developmental model used for children and adolescents, and it's also a model that's able to be used by adults in organisations, in corporates, and it can even be used in a whole wide community such as a town or an organisation, a larger organisation, to help build the resiliency of that town or that organisation. Some of the challenges that GPs are finding in being able to assess young people's need for mental health support is they've only often got about maybe 5 to 10 minutes to do an assessment, for one. Two, quite often the young people are not coming to see the GP in the first place unless they've got some sort of health complaint. And you know, young people, particularly females, tend to come to GPs a little bit more often than males. But you know, GPs are having to make very quick assessments and being able to put them through to, say, a psychologist or give them a mental health care plan. But the difficulties that GPs are finding is that, one, they're not getting them in the first place. Their parents might be coming, but they're not getting them in the first place. Secondly, they haven't got enough time to actually make that assessment. And thirdly, oftentimes they get referred to the psychologist first, and the psychologist sends them back to the GP, and the GP then has to do a mental health review, and that's sort of a bit muddled up. Some of the psychological difficulties that people have can be traced back to childhood, but not always. But most of the time we've sort of got to be aware that there are many factors that develop our resilience and that develop our mental health and our ability to show our emotions. And sometimes those emotions and mental health issues come from their relationships that we've had with other adults in our life. And so it may be early childhood that it sets down the neurons and sets down the pathways of how we manage our emotions. But it's not always about childhood, and it's not about blaming parents. It's about looking at what other factors have built that child right up to the ages of 18 to 20. What are the relationships that they've had that have actually developed the skills that they need, and to lay down the formational pathways that will set them up for life.
Leading the way in treating clients with addictions, Bondi-based psychologist Tara Herster spoke to us about treating mental health issues around stress and anxiety when substance abuse may also be present. Tara also talks about workplace culture impacting people's lives, creating stress and leading to burnout.
So my name is Tara Herster and I'm a registered psychologist. I work in Bondi Junction in New South Wales, Australia. I've been working in the field of addiction for around 6 years, both inpatient, outpatient, private and non-for-profit sectors. The clients that I tend to see that are coming with addiction concerns typically present with other mental health concerns as well. That can range from anxiety, depression or stress within the workplace. Quite often people are falling, I suppose, victim to the culture of the industry that they're in, or perhaps this could stem from a historical concern around substance abuse within their family or their environment. But yeah, predominantly the mental health concerns that I see are definitely related to stress and anxiety or depression. The concern with diagnosing these mental health concerns when there are substances involved in the person's presentation is you're not sure whether you're seeing an actual mental health concern or whether it is as a result of the either the come down or the intoxication of a substance. So it can be really tricky to do for medical professionals or psychiatrists to diagnose off one initial session. So it is really important to have a really broad history for the client, and understanding that rapport is really important as well. The more rapport you have, the more likely it is that someone's going to tell you the truth if they're using something. So it is really important to kind of have that time and space to get to know the person over a few sessions before any diagnosis is made. In my work, I tend to focus mostly on working around the substance use concerns first, and then looking at how to manage the mental health concerns for that reason. So some of the things that can impact on someone's stress is definitely the workplace culture. If we have a culture that is not open to having those conversations around, I suppose, outside of Are You OK Day, it's really important to start to bring that into light, because prevention is really much better than any type of cure that we could possibly bring to the table. So having a culture within the organisation of truly caring about the welfare and work-life balance of each person within the organisation, both from people who are doing some great work on the ground all the way up to the top line executives. It's really important to really be focusing on work-life balance. And I suppose that brings into the mix that there can be some things that are going on in people's personal life that does sort of feed into how their stress is managed at work as well. And it is really important that within the work environment that those conversations can be had too. I suppose the EAP service is a really great way of handling that as well in a short-term solution. EAP services usually provide a sort of short-term care, usually over the phone. It can be also face-to-face. One of the limitations of the EAP services is the amount of sessions that are available to each person within the organisation is already predetermined by the organisation usually. So what that means is you may have already built rapport with the person that you're working with, and you're just starting to get a roll on, and the progress is happening, and then it's cut off. So you need to build rapport with someone new, whether you're going to seek out your own support or perhaps a different phone service. So it is really great, an EAP service, as that sort of short-term kind of crisis management sort of space, and even for something that's a bit of a simpler issue that can be resolved within that time frame. However, there are some times where perhaps with bereavement or whether there's perhaps some workplace bullying or other kind of stress management concerns, that's where a longer amount of sessions can be really beneficial.
Accessibility to mental health care professionals becomes important when putting the client first. Lyn Health is a web-based telehealth platform with over 150 psychologists delivering consultations across Australia via secure video connections. Founder Dr. Jonathan King and psychologist Brianna Jane Sader tell us how the platform benefits those needing mental health treatment.
Hi, my name is Dr. Jonathan King. I'm a medical doctor and the founder of Lyn Health. Lyn Health became a reality after working in North Queensland, realizing the difficulties of mental health support in North Queensland and around regional rural areas in Australia.
My name is Brianna Jane Sader, and I am a registered psychologist with AHPRA. I work in Western Sydney, and I am one of the psychologists you can find on Lyn.
Lyn Health is an online platform that allows anyone to have online video and phone consultations with over 155 psychologists. Lyn is an affordable and easy to access service that allows people to get better mental health care in the comfort of their own home. Telehealth is the use of technology to enhance healthcare delivery and services via online video, phone, or apps. Telehealth is really beneficial to improving healthcare delivery for those in metro, regional, and remote areas in Australia.
So Lyn makes mental health support accessible to a wide range of people. Those people in regional and remote areas of New South Wales and all over Australia who aren't able to access psychologists as easily as people in metro areas have access to psychologists when they need it. So we're available to clients at any time of the day. But for those people in metro areas that suffer from mental health issues, that may find it difficult to get out of the house or leave the house for whatever reason, this is a way for them to still access the mental health support that they need. It also has benefits for busy working mums, for example, who might not be able to leave the house of a night time to go to an appointment. This would be something that they might find useful as well. Therapeutically, it's important that they feel comfortable getting to know us. Lyn makes it easy for them to read our bios and pick the psychologist that they want, so hopefully they're comfortable with us before they meet us. And also I think it's important that they have the accessibility of us when they need it. So if they can't make an appointment face to face and they can make one online, they're more likely to attend those appointments. Lyn is not an emergency service, so for those clients that might be at a high risk of harm to themselves or to other people, and they're in need of immediate medical attention, Lyn wouldn't be suitable for them. We would recommend that they contact an emergency service or out of hours service provider. Also, those under the age of 18 need parental consent to use the Lyn platform. Being in consultation with their parents and getting their consent to talk to a psychologist is important as well.
Lyn Health is a web-based platform that allows anyone with an internet connection, a computer, and a webcam to have easy access to therapy in the comfort of their own home. Some of the limitations of using Lyn Health are those in regional and rural areas who do not have adequate internet speed. Currently, we have over 155 Australian trained psychologists on Lyn Health, and we're completing roughly between 45 to 65 sessions a week.
Some of the benefits to using Lyn as a psychologist is that I can make myself accessible to clients when I choose to be accessible. So if I want to work after hours or on weekends, I can do so. Billing is also taken care of by Lyn, so that's not something that I have to worry about. When a client comes to me, I know that that's all been taken care of. Also, continuity of care is really important. So if a client moves interstate or if they go on holidays, they can stay with their chosen psychologist and they don't have to miss an appointment. There are some interventions that would require face-to-face interaction. So for example, if I wanted a client to complete an IQ assessment or some sort of educational assessment, I would need to refer that client to someone who can do that face-to-face. I might do so using their GP, and then those reports could be sent back to me so I can continue the therapeutic work that I'm doing with that client with the added information that assessment has provided. There are some assessments that we can conduct on the internet using Lyn. For example, we might use the DAS or the K10 with our clients to assess their progress over time with us. But for those that we can't use, we can refer and get those reports back.
Currently, Lyn provides only mental health support via psychology, but later this year in 2018, we will be launching further specialties to better support other health practitioners, especially GPs in regional and rural areas, to have a holistic support system via online telehealth.
It's been a big month in mental health awareness, and we'll continue to report on new developments. Thank you for watching this month's episode of Australian Health Journal. Next month, we'll be reporting on Parkinson's disease, asthma treatment, and heart disease. Until then, goodbye.